The FDA announced a new method to screen for cervical cancer. It's a self-administered test only using a cotton swab. The goal, reach populations who are not routinely screened, and to make the test that is historically dreaded by patients a little more comfortable. Certain populations have encountered barriers to cervical cancer testing largely because of the unfavorable method of a pap smear.
Someone who had trauma or someone who has a different ability in terms of their use of their legs and hips, someone who's confined to a wheelchair or confined to a bed.
Dr. Caitlin Lee, who works at Wesley Community and Health Centers, a state-funded program that serves uninsured and underinsured patients, says 30% of the population is not up to date with their screenings. Now the self-test opens new doors for prevention.
Cervical cancer screening is recommended for all individuals with a cervix, so that's regardless of gender or identity. So I think that transgender populations are also particularly vulnerable.
Dr. Lee also says the privacy offered with the self-test should also increase screening among the transgender community. This is only the first step. Childcare, work responsibilities, and lack of transportation are still problems. Cervical cancer survivor Gail Peterson-Hawk speaks on her own experience.
Appointment still has to be made. The person still has to travel to the clinic, get the child care.
After this initial rollout, the FDA anticipates approving a home test, eliminating time and cost concerns. But it brings other challenges.
When people do more testing at home, that they remain more isolated, they don't develop those relationships.
Right now, patients still have to take the test in office. Gail Peterson-Hawk says communication is key.
You really have to be your own advocate. It's a shared responsibility, but the responsibility falls on the person who needs to have the screening or the return to care.
Dr. Sharon Thompson says the anticipated at-home test expands reach, but it is not the end-all, be-all answer.
These at-home tests are great, but they do not replace medical care because you don't have the training a doctor does.
Dr. Lee expects the self-test should be available in clinics at the end of summer or in early fall. And Dr. Thompson noted the expected insurance price is anywhere from $69 to $100.